Contraindications, complications, and aftercare. You will find the full information in the PDF file, and here I will focus on the main practical aspects. We all know that in reality it's not always as in the theory. So here I will tell you the little tips of what to expect and what to tell your client for the aftercare and when not to perform the treatment. So if your client is a healthy individual and doesn't have any strange features of the skin, normally what will happen that after the treatment her lips will be quite swollen. There can be some bruising visible on her lips immediately after, and it might last for 1 to 2 weeks till the bruising disappears. The swelling disappears in a couple of hours. So when you will not perform the treatment, it's if on your client's lips there are any inflammations, infections, or the skin is injured. You will not perform it if your client has an active cold sore outbreak. Concerning the cold sores, if your client has a history of cold sores, she should be taking special medication before, a couple days before, during, and couple days after the treatment. It will depend on the instruction of the drug used. Creams will not be ideal. Creams which heal the cold sores, it will not be ideal because they just dry the surface of the skin and then the healing process can be impacted. So it's better to take a pill. Normally it's prescribed by the doctor. Talking about the complications, one of the most important things which could be considered as a complication is an accumulation of the filler in the lip skin after the treatment. So in order to avoid that, it's very important to massage the lips after the treatment so there are no hard places or that you would feel with your fingers that there is an accumulation of the filler. If your client will still feel at some point that there are little accumulations, she can massage the lips herself. Bruising is not considered as a complication. Bruising and swelling, these are just some normal things which can happen after the treatment and which disappear in some time. The overview of the products needed. So we will need a disposable cap for your client's hair, then a disinfecting solution for the skin, and a separate one for the tools. Then the Hyaluron Pen itself. There are different types of Hyaluron Pen. We will work with this one, which you see in the video, but you can have an overview in the PDF theory file. So here we are removing the cap and we have a metal part on which this disposable capsule will be attached. The filler will be put inside this capsule. So now here is the filler itself. It normally comes in such a package with a couple of needles as well, but we will not need those needles. Then some cotton, some paper tissues to disinfect the machine, disposable protective gloves, and some wet skin napkins. So how to assemble the machine? First of all, we have to disinfect the machine itself. We will use spray disinfection solution with a paper towel. And we will rub the machine all around. We also remove the cap to prepare it for the installation of the capsule with the hyaluronic acid serum. In this course, we will use this particular type of Hyaluron Pen. There are different types of them which are loaded differently. So here we will prepare the capsule. We remove it from the sterile package And we remove a little cap, which is a protective cap on the tip of it. Then we will open the serum itself. It normally comes in such a package with 2 disposable needles. We will not use the needles, obviously. We just need the serum syringe itself. And we will squirt the serum in the capsule. Here we have a capsule which will be screwed on the machine and in which we will put the hyaluronic acid serum. There's a plunger which you will take out with the tweezer, and inside you will put this product, which you can see. I will not mention the brand just in case, but normally it comes in such a syringe, and you will push it out into the capsule. Here you have a marking of how much of the product there is. Normally we will use from half of the milliliter or full milliliter. In the syringe there is 1 milliliter. So now I will demonstrate how to put the serum into the capsule. Don't be too fast, because otherwise you might lose some product. It will not go into the capsule properly. So just slowly squirt it in the capsule. Depending on your capsule capacity, you will put half or full milliliter. Sometimes it's 0.3 as well. So slowly I am pushing the product out, and now we will put the plunger back to close the capsule. So this you will do quite slowly as well, so that the product is properly pushed up. Don't push the plunger until the end, because you will need to fix it on the machine. You will understand what I mean in a second. So here we have half of the capsule, and there is a little bit of the plunger which is out. If you have any residue of the serum, please wipe it off, not to damage the machine. You can use a simple napkin, as you can see in the video. So now we will screw the capsule on the machine. The plunger goes on top of that metal part. And now we have to adapt and screw on the capsule on the machine. So now you will use the rolling part of the machine to pull the metal part in, so that the capsule can be screwed on. But also the plunger, as you can see in the video, the plunger is going a little bit more up and pushes the serum near to the little hole of the capsule. So what we need to do is to push the serum until the opening of the capsule and fix the capsule to the machine. So now we are regulating this. I'm using the rolling part to do it, and I screw the capsule on, and you can see until where the product is pushed. And if you can see, as you can see in the video, there is a little part where a red line is. So with that little part, we can later fix the rolling part. So if you kind of push it down, the rolling part will not move anymore. And to prepare our machine with the product, we need to roll it until a tiny drop of the product is out of the capsule. Like this, we know that the product really filled the capsule well, and when we will put it on the surface of the skin, it will immediately be injected. The button I just showed, we will push it when we will want to push out the product out of the capsule hole. And in the little glass screen, you can see numbers. This will signify the amount of the serum pushed out. The minimum is 4. That's what we will normally use for the lips. And you can regulate the amount as you wish, but the optimum would be 4 or maximum 5. So I froze the video on purpose, don't worry. And now we will move to the next steps. The button is pushed in. We need it to be pushed out. So we will scroll the machine until the button pops out. And then when the button is out, we scroll it backwards to define the amount in the little glass screen. So we will keep it on 4. Then, normally because of all this scrolling, a little bit of product residue goes out of the little capsule hole. You just have to wipe it off because we need a clean and dry surface when we are putting the capsule on the skin. And then you will push it out, but before you have to push the safety button on the side. You push the safety button off, kind of off, and then the main button.